Rutina Rutinuri. Today we are going to talk about lactose intolerance and lactose malabsorption. These terms sound similar, but they mean different things. So, lactose intolerance starts with something called lactose malabsorption. Lactose malabsorption is when your body can't digest lactose properly. This happens because you don't have enough of an enzyme called lactase in your small intestine. Normally, lactase breaks down lactose into glucose and galactose, but when you don't have enough lactase, the lactose doesn't get broken down. Instead, it travels to your colon where bacteria ferments it. This fermentation creates gas and other molecules that causes symptoms. Next is lactose intolerance. Lactose intolerance is what happens when malabsorption actually causes symptoms. These symptoms include bloating, abdominal pain, gas, nausea, and diarrhea after eating or drinking dairy products. You can have lactose malabsorption without having lactose intolerance. Many people with malabsorption doesn't get symptoms at all. It depends on how much lactose you eat, your diet, and how sensitive your body is. The spectrum of intolerance and how lactase deficiency leads to symptoms. Lactose intolerance isn't black and white, it's a spectrum. Here's what affects whether you get symptoms. Firstly, dose of lactose. Less lactose means fewer symptoms, and more lactose means more symptoms. That's why some people can handle a little bit of cheese but not a glass of milk. Second, gut bacteria. If you have bacteria that helps digest lactose, you will tolerate it better. If you don't have helpful bacteria, you will have more problems. Thirdly is how fast your stomach empties. If food moves slowly through your stomach, you have more time to digest lactose. If it moves fast, you are likely to get symptoms. Fourthly is sensitivity. Some people's intestines are just more sensitive to gas and other byproducts. They feel symptoms more easily. Everyone is different and symptoms vary based on all these factors working together. So, what actually causes these symptoms? When undigested lactose reaches your colon, three things happen. Firstly, fermentations. Bacteria in your colons break down the lactose and produce gas like hydrogen and methane. This causes bloating, gas, and pain. Secondly is water retention. The lactose pulls water into your intestine and causes diarrhea. Thirdly, increased movement. All this activity makes your intestine move faster, which causes cramping and that urgent feel. To sum up, lactose intolerance is different for everyone, and symptoms happen because of bacteria fermentation and water being pulled into your intestine.
Assalamualaikum and hello everyone. My name is Haidunisa Shafiqah. Now I will explain about how lactose is normally digested in the human body. Lactose is a disaccharide sugar made up of two smaller sugars, which are glucose and galactose. It is commonly found in milk and dairy products. Because lactose is a large sugar molecule, it cannot be absorbed directly by the intestine. It must first be broken down into smaller molecules. This digestion mainly occurs in the small intestine, especially in the jejunum and upper ileum. The enzyme responsible for this process is called lactase, also known as lactase fluorescein hydrolase. Lactase is located on the brush border membrane of the intestine villi. This enzyme breaks lactose into glucose and galactose, which are monosaccharides. This breakdown step is very important because only these smaller sugars can be absorbed properly. Without enough lactase activity, lactose will remain undigested in the intestinal lumen. Okay, so here I will explain on how lactose is absorbed after digestion and what happens in lactose intolerance. After lactose is broken down into glucose and galactose, these sugars are absorbed through the cell lining the small intestine, called enterocytes. Glucose and galactose enters the enterocyte through a transporter known as SGLT1. This process requires sodium and is an example of secondary active transport. Once inside the enterocyte, glucose and galactose leave the cell and enter the bloodstream through another transporter called GLUT2. The sugars then travels through the portal circulation to the liver. In the liver, They can be used immediately for energy, stored as glycogen, or converted into another molecule needed by the body. However, if lactose is not broken down due to a lack lactase, absorption cannot occur, which the undigested lactose stays in the intestine and moves to the large intestine. In the large intestine, bacteria ferment the lactose, producing gases and acids. Lactose also draws water into the intestine. This leads to a symptoms of lactose intolerance such as bloating, abdominal pain, or diarrhea.
Hi, I am Amalina, and now I will explain the types of lactase deficiency. The first type is primary lactase deficiency, which is the most common type worldwide. In this condition, the lactase enzyme naturally decreases after childhood as part of normal development. It is strongly influenced by genetics and is very common among Asian populations. Because of this gradual decrease, symptoms usually appear slowly, such as when teenagers or adults begin to experience discomfort after consuming dairy products. The second type is secondary lactase deficiency. This occurs when the intestinal lining, also known as the villi, is damaged. Conditions such as gastroenteritis, celiac disease, chronic disease, or irritable bowel syndrome can reduce lactase production at the brush border of the intestine. This type is often temporary, as lactase level may return once the intestine heals. The final type is congenital lactase deficiency, which is very rare. It is a genetic condition present from birth. Infants are born with little or no lactase, making them unable to digest breast milk or formula containing lactose. Symptoms appear immediately after feeding, and these infants require a lactose-free diet. Next, I will discuss the clinical manifestation of lactase deficiency. When lactose is not digested in the small intestine, it moves into the large intestine where bacteria ferment it. This process produces gas and acids, which leads to various gastrointestinal symptoms. Firstly, bloating occurs when gas produced during bacterial fermentation accumulates in intestine, creating pressure and a swollen feeling. Second, abnormal cramps happen because gas and acids stretch and irritate the intestinal wall, causing the smooth muscle to contract painfully. Next, diarrhea occurs when undigested lactose pulls water into the intestine due to its osmotic effect, resulting in loose or watery stools. Flatulence is caused by the release of gases such as hydrogen, methane, and carbon dioxide during fermentation. And lastly, cause nausea results from irritation caused by acids and intestinal digestion, which activates the gut-brain axis and may also lead to loss of appetite.
Hi, my name is Shafini. I will talk about the long-term health implication of lactose intolerance. People with lactose intolerance often avoid all dairy products, and this may lead to low calcium intake, which is needed for bones. Over time, this will increase the risk of three major health issues. Our first and most critical implication is osteoporosis and weak bone density. The body has a survival priority. It absolutely must maintain calcium level in the blood for vital function like your heart and nerve function. If dietary calcium is low, the body activates a survival mechanism that essentially sacrifices bone health. This mechanism involves the release of parathyroid hormone or PTH. PTH will signal cell called osteoclast, the bone-breaking cell, to dissolve bone tissue. This process extract calcium from your skeleton and move it into the blood to maintain those critical serum level. This is especially dangerous for adolescents and young adults if they fail to reach their peak bone mass in their 20s because they are avoiding dairy. That lower baseline significantly increase their risk of severe osteoporosis later in life. Our second implication is muscle weakness. Muscle contraction is fundamentally dependent on calcium. Calcium ions are the specific trigger that allow muscle fibers to contract, binding to protein to enable the filament to slide past each other. Chronic low calcium or hypocalcemia disrupt this process, leading to symptoms like muscle cramps, spasms, and general weakness. We must also consider vitamin D. People who avoid dairy often have a vitamin D deficiency, which is independently linked to muscle atrophy, also known as sarcopenia, and reduced muscle strength. Finally, implication 1 and 2 combine to create our third and most serious risk, which is higher fracture risk. The combination of chemically weak bones and reduced muscle stability creates a perfect storm for fractures. Patients who have developed osteoporosis often experience what we call fragility fractures. These are fractures that occur from incredibly low impact event, something as minor as a fall from a standing height, or even just a strong cough, can cause a vertebral fracture. Studies have shown a strong correlation with women who have genetic lactose intolerance having lower bone mineral density and a significantly higher risk of non-vertebral fractures compared to those who can digest lactose. And that's all from me.
Good morning, everyone. My name is Danish Ilfai Tisam, and I will be presenting the final part of our presentation. I will explain the dietary approach used to manage lactose intolerance. First, individuals are advised to reduce or eliminate lactose-containing foods such as regular cow milk, ice cream, cheese, and creamy dessert, as these foods commonly trigger symptoms like bloating, abdominal pain, and diarrhea. Next, lactose-free milk or A2 milk can be used as an alternative. Lactose-free milk has already been treated with the lactase enzyme, making it easier to digest. A2 milk contains only A2 beta-casein protein and may be better tolerated by some individuals, although it still contains lactose. Another strategy is to gradually reintroduce small amount of dairy. This helps some individuals identify their tolerance level without triggering severe symptoms. Lastly, consuming dairy products together with milk can slow down digestion and next, for this slide, I will talk about the management strategies on medical approach. This slide focuses on the medical approach for managing lactose intolerance. Firstly, it is important to treat the underlying cause, especially in secondary lactose intolerance. Damage to the intestinal lining caused by infection, inflammation, or gastrointestinal disease can reduce lactase production. Treating this condition allows the intestine to heal and may improve lactose tolerance. Secondly, individuals can choose probiotic strains that help digest lactose, such as Lactobacillus acidophilus, Lactobacillus reuteri, and Bifidobacterium. These probiotics produce enzymes that assist in lactose digestion and help reduce gastrointestinal symptoms. Another option is use the lactase enzyme tablet before meals. These tablets supply the lactase enzyme needed to digest lactose and can help prevent symptoms like bloating and stomach pain when consuming dairy products. Finally, for individuals who avoid dairy completely, calcium and vitamin D supplementation is recommended. This helps prevent nutrient deficiency and ensure educated bone health despite reduced dairy intake. In conclusion, lactose intolerance can be effectively managed through a combination of dietary adjustment and medical strategies. With proper management, individuals can still maintain good nutrition and quality of life. That's all from me. Thank you.